My name is Mimiwati. I am a consultant ophthalmologist with the Faculty of Medicine, University of Malaya, in the Department of Ophthalmology. Well, ophthalmology is about the diseases of the eye and the health of the eye, and basically we take care of patients' vision. Even though the eyeball is small, it is a very complex structure, and in fact, even in our field, there are about 6 subspecialties. My subspecialty is glaucoma, which has something to do with the disease of the optic nerve. Um, there are other subspecialties such as cornea and entry segment, uveitis, medical retina, neuro-ophthalmology, vitreoretinal surgery. So it's a very interesting field because each and every field there's actually very little overlap within different subspecialties. Our department has been conducting the Masters of Ophthalmology program, which is a 4-year postgraduate degree program since 1992, and so far we have produced 120 over ophthalmologists for the country. Um, right now, we also have an eye research center called the UMERC. This was set up about 6 years ago with a very generous grant from the university. And since then, we have been able to do quite a bit of research, collaborating with not only our local centers but also international centers. For example, the Lions Eye Institute in Perth, the Singapore Eye Research Institute, and also Johns Hopkins in the US. The main concern is actually blindness from cataract and glaucoma, and also diabetic retinopathy. With cataract, fortunately, it's reversible because when you do cataract surgery, you take out the lens and you replace it with an artificial lens. But where glaucoma is concerned, it is a disease of the optic nerve due to high pressure in the eye that is largely irreversible. It is also called the thief of sight, and therefore disease like this is the one that we need to prevent. We are doing quite a few screening procedures to catch this problem. And diabetic retinopathy is the other one because, as you know, diabetes is um, quite prevalent in our country, and uncontrolled diabetes at that. So this affects the eye as well. So every diabetic patient should actually have their eyes checked at least once a year. Our department, of course, aims to be the best, if possible, at least in the country, or if not in the region. I think as of now, we are sort of the top favorite on the list for candidates uh, when they apply for the master's program. I think largely this, in fact, is due to our strong faculty. We have 15 lecturers so far, and our lecturers cover, in fact, all subspecialties right now. I think the students know that uh, they can be they can get good quality teaching and supervision. I think those two things are very, very important. And also because through our eye research center, and we've also been endowed with quite a few grants, we are able to equip our clinic with state-of-the-art instruments, which is important for them because they would have to publish a dissertation at the end of their final year. Other than taking care of your general health, taking care of your diet, exercise, I think where the eye is concerned, it's mainly for the public to come for screening, because I think it's the blinding diseases are the one which are largely sort of preventable if you come and get treatment quickly.